Did you know there are two main types of diabetes called type 1 and type 2? And the differences between those main types. Before exploring the main differences between these types, let us revisit some background about the disease. In a medical point of view, diabetes is a chronic disease which occurs due to insulin resistance or insulin deficiency. There is no cure for this disease, but type 2 diabetes mellitus can be preventable by lifestyle modifications. When we consider the normal human body, sugar is the primary fuel for our body cells, which we pump in through digesting foods that we eat. Sugar molecules in the body, known as glucose, circulate via blood flow, and supply nutrition to cells to produce energy. If blood sugar levels are increased beyond healthy range, we call it hyperglycemia, and if decreased than healthy level, we call it hypoglycemia. It is a miracle how the sugar-controlling mechanism preciously functions to keep blood glucose levels well balanced. The key to this mechanism is the hormone called insulin, which is produced by beta cells of the pancreas. Diabetes can occur due to no production of insulin, resistance to insulin, or imbalance of insulin level. Let's find out what are the differences between type 1 and 2 diabetes mellitus. There are various causes to develop diabetes mellitus, but they differ according to the type of diabetes. Most of the time type 1 diabetes diagnosed in childhood and young age, but type 2 occurs in adults who are over 40 years. But in this modern society, the trend is that people get type 2 diabetes even at young ages due to modern lifestyles. Let's find out causes for diabetes. What are the causes for type 1 diabetes mellitus? Body's immune system helps us to fight with foreign invaders such as viruses and bacteria and to keep ourselves healthy. In type 1 diabetes, the immune system identifies our pancreatic beta cells as foreign cells, or enemies, and produce antibodies against them. These antibodies destroy pancreatic beta cells, so pancreas becomes unable to produce insulin. It is a genetic disease which cannot prevent. What are the causes for type 2 diabetes mellitus? Type 2 diabetes may occur due to various reasons, out of which insulin resistance is an important causative factor. Researchers are struggling to find a specific reason for the development of this resistance, though. Some people with type 2 diabetes may have insulin in their body but fail to carry out their function effectively. Although the body tries to produce more and more insulin in those people, that effort is not sufficient. Risk factors. Although we discussed the causes for type 1 and type 2 diabetes mellitus, there are also some risk factors which precipitate those causes. What are the risk factors for type 1 diabetes mellitus? The family history of type 1 diabetes mellitus. Genetic pattern of cells. Environmental factors affecting the gene activation. What are the risk factors for type 2 diabetes mellitus? Overweight. Family history. Age more than 45 years. Physical inactivity. History of gestational diabetes. Having polycystic ovarian syndrome, this is a disease condition in women ovaries. Increased belly fat layer. Let's find out symptoms of diabetes. Both types of diabetes have common symptoms due to excess sugar in the blood. Those common symptoms are: increase the frequency of urination, increase thirst, increase hunger, fatigability, blurred vision, not healing the wounds quickly and properly, numbness and tingling of hands and feet. In addition to the above symptoms, people with type 1 diabetes may experience irritability, excessive weight loss or weight gain, mood changes. What are the tests for diagnosing diabetes? Sometimes we self-diagnose diabetes based on the symptoms if there is a family history. Then we visit a doctor and ask, I have these symptoms and family history. Do I have diabetes? It is not that simple to diagnose diabetes by considering only symptoms. It is essential to do a blood test to confirm diabetes. Mainly there are 3 tests to confirm diabetes mellitus. First, oral glucose tolerance test or OGTT. This is a gold standard test to diagnose type 2 diabetes mellitus and gestational diabetes mellitus. Second, fasting blood sugar level check. This test should be performed after 10 to 12 hours of fasting. The normal range should be less than 100 mg per deciliter, or 5.6 mmol per liter. If it is between 100 to 125 mg per deciliter, or 5.7 to 6.9 mmol per liter, is considered as impaired fasting glucose level. But if fasting sugar level goes beyond 125 mg per deciliter, or 6.9 mmol per liter, in 2 separate occasions we can confirm diabetes mellitus. Third, HbA1c test. In this test, doctors check for glycated hemoglobin level, which shows the concentration of sugar molecules bonded hemoglobin in our blood. If HbA1c more or equal to 6.5%, it's considered as diabetes. We can perform this test at any time. Fourthly, to differentiate type 1 and type 2 diabetes, doctors do a blood test to detect antibody levels. If antibodies are found in the blood sample, it is considered as type 1 diabetes mellitus. What are the diabetes treatment options? For type 1 diabetes, the only viable treatment is insulin. Sadly, there is no cure for type 1 because the immune system destroys the pancreatic cells producing insulin. People with this type of diabetes need regular insulin injections. However, for type 2 diabetes, there are several treatment options. First, modify the lifestyle and the diet because nutrition management is part of treatment. Strategies include regular exercise, reduce weight, keep the body mass index between 18.5 to 24.9 kilograms per square meter, diet and individualized meal planning, and many more live healthy strategies. Second, take oral drugs to control blood sugar level. Drugs may help to enhance the action of insulin. Third, insulin treatment. Insulin need when oral diabetes drugs fail to maintain the blood sugar level within a healthy range. What are the complications if the diabetes was not managed well? Both types of diabetes show the same complications, as most of them are due to poor blood sugar control. Main complications are as follows: high blood pressure, hypoglycemic or hyperglycemic attacks, peripheral neuropathy, sickness of nerves commonly in legs, heart diseases, infections mainly in foot and skin. In this video, we have discussed many differences between type 1 and type 2 diabetes. Finally, if you have diabetes, the most important things to do are monitoring blood sugar level regularly, taking treatment timely, and controlling blood sugar level optimally. Medical practice considers they are as the pillars for having a quality life when you live with diabetes.